Hello and welcome to Yashoda Hospitals. I'm Pratyusha Chaudhary hosting Nursing Education and Training webinar series live on Facebook every Thursday at 3 p.m. bringing forth the most interesting topics. Thank you for joining us today. Stay tuned till the end and also please kindly post your queries in the chat section in case if we can address it at the end of the webinar. Nurses work in complex adaptive systems that changes moment by moment, and organizational factors such as workplace distractions also will be the main task which will be done during the medication administrations, which can also cause the risk for errors. Also, human factors contributing to errors are enormously high. This shows that attitude towards medication safety is not always being prioritized, nor is safety culture being deeply adopted. Talking about all this, diving deep into the topic, we have our topic for today is medication without harm, strengthening medication management framework in healthcare professionals. So without further delay, let me introduce you to the pros of today's webinar. I take the privilege of introducing our expert panelist for the day, Dr. Srinivas Garu, MD, General Medicine, Senior Consultant Physician, Yashoda Hospitals, Malakpet. Looking forward for your input, sir. I'm happy to introduce the speaker for the day, Ms. Jivita, AGM Nursing Education and Training, Yashoda Hospitals, who is my colleague who has got enormous decades of experience with her clinical expertise. Also, she supports us in improving the standards of nursing education and training. Over to you, Jivita.
Jivita, please unmute yourself. Jivita, good to start.
Yeah. Thank you, Pratyusha, for introduction. Very good afternoon, one and all. It's my pleasure to start, to talk about the medication administration without harm. So today we'll discuss, let's discuss the role of healthcare team in adhering to standards, because who are the responsible team in medication safe administration we'll discuss, and also what are the common checks, medication errors, and what are the unsafe medication practices, how we have to prevent. And also we have to understand the human factors, especially the reporting errors, knowledge of pharmacology, and what are the perceptual factors that we have to consider before administration. And also we have to, we'll discuss about the lack of technological skill also will leads to the human factors. So, and at the same time, we'll discuss about global patient safety challenges also. So as we all know, see, why I have taken this slide, most of the time we feel the medication is simple, only we have to administer. But as a healthcare professional, especially, it's an interlinked team, and the major role plays by the nurse. The unsafe medication practices, if you see, globally, $42 billion means they are using, and at the same time, 1.5 million also errors have been seen. So why I'm emphasizing on this, as a nurse, you have to be very take caution before administration of any type of medication. So World Patient Safety Theme, if you see in most of the time we celebrate the patient safety days. So in that, this time slogan, they have taken medication without harm. So medication plays a major role in aspect, means in related to the patient safety. Mainly it is focusing on the medication safe administration and free from harm. So this year theme, they have selected medication without harm. As we all know, the World Patient Safety Day will celebrate September 17. So this time they have taken this as a slogan to prevent especially the medication errors. So as I mentioned, the role of healthcare team, yes, of course, the medication administration may not be a single means individual task. It is a team and collaboration where the three major people will involve. Those are doctor, nurse, and the pharmacist. So whenever you administer any type of medication, the doctor will prescribe the medication. As we all know, the pharmacist procure the medication for the pharmacy and dispense them, and the administration part, major part, will done by the nurse. So here, if there is an error in prescription or dispensation, as a nurse, she can check all the rights, and she plays a major role in prevention of medication errors. So situation, yes, of course, we know that these are the responsible people are involved in medication administration. Then what are the situation may lead to medication errors? Yes, of course, we are human beings. So sometimes there will be a chance of errors, especially during crisis situation. When the patient becomes emergency, most of the time we'll get panic and we may not listen to the orders properly. There may be a chance. And handover takeover time, yes. Especially during handover takeover time, we will be busy in handover takeover, and sometimes we may forget to administer the medication. Otherwise, we may hand over the medication to a patient. So these may lead to either administration errors, novice nurse. Yes, when the new nurse comes, it is very difficult. See, practically, whatever we say, as per my knowledge, the nursing is transformation of knowledge into skill. So whatever we read, whatever we practice, entirely different. So always we should have that means coordination with the knowledge and the skill. And if the new nurse comes also, it will be difficult for her. So sometimes they may not know the much drugs. So because of them also, there will be a chance stock shortage and unavailability of medication. Sometimes what happen, ready-made dose may not be available. So the sister, if she did not have any knowledge about that medication, she may not administer, or she may administer wrong medication. So these are the situation where the medication errors may arise. So how we have to prevent the errors? Especially, as I said before, usually medication process starts from prescription by the doctor, transcription by the DMOs, and dispensation, procurement from the pharmacy, then administration. So whatever drug, if you want to administer, this is a process we follow. So if you see this figure, most of the time prescription errors are 18%, transcription, dispensation also less comparatively with the administration errors. So the administration part will be done by the nurse. So as a nurse, check for all the rights to prevent medication errors. So by seeing this slide, you can understand most of the time there will be administration errors. So if the nurse is very particular and if she follows all the rights, then we can prevent most of the errors. Because sometimes in prescription error where there is a problem, so as a nurse, she has to check for all the rights. If she find any error, she has to identify, resolve, and try to decrease the errors as many as possible. Swiss cheese model. So if you look at this also, most of the time, here we can observe like patient monitoring, how the adverse drug events, how it leads. Because if the doctor advises for any prescription error, the nurse should identify that error and she has to see for the patient education, and nurse should order that review, pharmacy order review also she has to follow. If she will do these all the things, might be we can prevent the adverse drug events. So as I mentioned, if novice nurse comes, in our studies also we used to have pharmacology. So we have to apply that knowledge whenever you practice your profession at clinical side. So if you follow this Swiss cheese model, like how the patient monitoring to be done after administration, what are the reviews you have to do, how you have to communicate with the patient, what type of education could be given to a patient before administration to prevent further side effects. So this Swiss cheese model really help us to prevent the errors. So as I said, the errors could be happen because of prescription, transcription, or administration. So how can we prevent this type of errors? So as a nurse, please alert, and before administration of any type of medication, you have to follow 10 rights. Those are right patient, yes. A right patient you have to identify with the patient ID band. Please identify with their ID band or IP number. Do not identify with the bed numbers, where the most of the errors will be happen. And always follow for the right drug. You need to check triple and right dose. Of course, dose is also very important. If you find any problem or any means you could not understand the prescription, so please, I'm requesting all the nurses, confirm, then you administer. Route is also very important, because most of the time what happen, few drugs can be given a particular route. Example, if you take, most of the time we give diclofenac IM, and at the same time tramadol also will give IV and IM. But once you give through IM, the dilution will be different. If you give through IM, IV, it will be different. So those things you should understand, and how you have to dilute also very important. And right time, yes, time also very important, because here we have to check, because most of the time drugs will be prescribed by the doctor based on the patient weight and the dosage, how it will be like thrice or twice. Based on that, we have to check for the timings also. The next, right education. Yes, as we all know, the technology has been improved, and most of the patient they are expecting that the sister should expect what type of drugs she is administering. So as a nurse, she should have knowledge about the drugs. At the same time, she has to give proper education to a patient. Right to refuse, of course, sometimes if the patient refuses the medication, as a nurse, we have to tell the consequences. If though the patient is not willing, then it should be documented in the medication chart. Right assessment, yes, this is also very important, because why you have to do the assessment? Few medication which may alter the vital parameters of the patient. For example, if you take a right assessment, you want to give antihypertensive medications. Whenever you give antihypertensive medication, most of the time we have to check blood pressure of the patient, which will be very important. At the same time, if you want to give insulin, you have to check the patient GRBS levels. So why the assessment also very important before administration, right evaluation. This evaluation to be done if you give proper education to a patient. Like, for example, most of the drugs will have side effects, but those side effects also you need to educate the patient before administration. Then you can identify the errors immediately, and you can take prompt action. Last but not the least, documentation. So documentation is also very important after administration. As we all know, if you do not document, it means that you have not administered the medication. So please, whenever you administer any medication, after giving only, you have to document. Never document before administration. So please take an important alert in documentation, because if you see the administration errors also, most of the errors could be documentation error, or wrong route error, or wrong dose error. So these errors are more comparatively other errors. So as a nurse, please take an alert, and you should know the drug. If you doesn't know, please confirm with your seniors, then you administer. But these are all the rights you have to follow before administration of drug, not after administration. Yes, understanding the human errors. Yes, because most of the time, what happens, though we follow most of the checklist and the standards, sometimes we may do errors. So if the errors have been happen, so reporting error mechanism should be implemented in the, because most of the hospitals will have errors, but how it has happened, where it has happened, we have to take the corrective action and make sure that the reporting error should be fact finding, not fault finding. So this type of culture you have to create. Otherwise, most of the errors will be they may not be exposed, or they will hide the errors. So to prevent that, you have to implement not blame culture. It should be like fact finding, not fault finding. and also knowledge of pharmacology. As I said before, see, most of the time you have to know the generic names than trade names, because in market you can see multiple companies have come. So most of the time as a nurse, because there may be a chance of double medications also to be administered with the same composition. So as a nurse, you should have knowledge of pharmacology, recognize perceptual factors. Like, you should not assume, because in other aspect, the assumption may be fine. But whereas in medication administration, you should not be assumed. If you have any doubt, please confirm, then you administer. Human factors and lack of technological skills. Yes, this is also very important. Nowadays, all the advanced technologies, for example, if you take infusion pump, the sister could not know how to operate that machine. So because of that, there may be a wrong dosage of errors might be happen. So these are the things you have to take into mind and try to improve your knowledge and try to escalate the errors if it has happened anything. And you all know very well about near miss, ADR, and sentinel events, which plays a major role in the medication errors. Near miss, can anyone chart what is the meaning of near miss? Okay, so the near miss, the sister about to administer, but she did not administer. After that, she has realized that the medication might be she's giving wrong. So that is near miss. About to administer, but it may not be happen. Any means the problem may not be arise after to the patient. Adverse drug reactions, sometimes if you give any wrong medications. Sentinel events is a very dangerous. So when if you give wrong medication, which may loss of life sometimes, so which may call sentinel events. So these are the errors are very dangerous. So always I used to try to discount, try to give discount to a patient rather than bonus. So what we have to do most of the time, we try to reduce the patient complaints and try to administer correct medications with correct time, with correct dose. So Super 7 nursing alerts. So as a nurse, you have to follow these rights. If you follow these rights, I can give guarantee that most of the errors will be resolved. First is avoid distractions. In recent studies in Canada, most of the foreign countries, they have done research. In that, what they have identified, most of the distractions will be happen at least within a 1 hour, 15 to 20 distractions have come to sisters during medication time. Either it could be patient call bill or patient like a phone, other doctors, and anybody. So these type of distractions we have to avoid by implementing like safe medication administration, do not disturb, please do not disturb, or medication administration zone. So if you put those type of board or anything, the others will be alert that we should not, because most of the time what happened, because of distraction, we will be confused and we may give wrong medication. And our focus will be, for example, we are loading the medication. If we got any distraction, so might be the dose error may happen. So to prevent that, safe medication administration or do not disturb, these type of policies we can implement and we'll try to reduce the errors. Then know your rights. As I already discussed before, you should know your rights before administration of medication. Always ask and counter check. Yes. Sometimes what happens, prescription errors. You may not understand the prescription. Of course, the legible right, whatever it may be, if you could not understand, confirm, then you administer. It doesn't harm that if you ask the doctor, ultimately he will explain. So try to confirm, then only you administer the medication. Stay updated. Yes, you have to update with your current knowledge of drugs and generic names and what education to be given to a patient and what is that particular drug. At least example like pantocid, we are giving antacid, like antibiotics. Those basic knowledge you should have before administration. Label properly. Yes. Always remember, whenever you load the medication, it should be documented before loading of second medication. That is universal protocol. never identify, means after dilution, all the medications will become similar. So please label properly and try to admit, because what happens if you do not label the medication, it will be very difficult for you. Few medications will be given very slowly, few can be given very fast. So if you label it based on that medication, you can follow. Error reporting already we discussed. So in the every hospital you have to make a protocol of error reporting. Check on antidotes. What is the meaning of antidotes? Okay, antidote also, it's like, for example, if you have given any wrong medication, which will be helpful to reduce the harm. I mean, it's a counteract to reduce or control the poison of the drug poisoning. So if you have given any wrong medication, if you see, for example, heparin, if you have given, then to prevent that antidote is a protamine sulfate. And also, like if you have given any opiates, naloxone, we have few antidotes. So as a nurse, you have to update this. You should know about this antidotes also. So understood, right? The Super 7 nursing alerts. So please follow this. If you have any problem or if you have identified any errors, please try to resolve it and try to document it properly, and always ask for the doubt, clarify, then you administer. Because once you have administered, it may fatal the patient, and sometimes we may lose the patient also. So please, medication administration is a major responsibility. The nurses plays a role. So I'm requesting you all, always follow the rights, not for namesake. Really you follow. And if you have any given, if you would like to give any like high risk medication, the cross check to be done before administration. These are the things like insulin, potassium chloride. These injections, always try to make a habit of cross check, then you administer. Best standards for error prevention. Yes, of course, in most of the hospitals, they use this barcoding system. It's an electronic system. As I mentioned earlier, we may have transcription errors also. So to prevent these transcription errors, the barcoding also will be very helpful. It's a scanning system where everything will be already there in the system. Just you have to scan with the patient ID band, and it will be helpful for you to give right dose of the patient, right patient you are identified. Everything will be possible with the barcoding, and most of the time the medication errors will be reduced with this barcoding system. Electronic prescription record also same. Sometimes we may not understand the prescription. So through electronic prescription record, already it is there in the system. So it will be easy for the doctor to send the pharmacist. Through that, he will dispense the medication, and there the relationship of the coordination, everything will be improved, and the errors also will be reduced. And also drug utilization record. It's like medication reconciliation, because in the drug utilization record, what happened, most of the time patients may forget their medications. So before, if they have any allergic, they may forget. In this type of electronic, what happened, what allergy drugs they have, what treatment they have given before, everything will be recorded in the system, and it will be easy for the doctor to prescribe the medication. And this automated medication dispensing system also very helpful to prevent the medication errors. So if we follow, apart from this this barcoding electronic prescription system, the human problems, whatever you have seen before slides, if you correctly follow this 10 rights or the whatever I said, most of the errors will be reduced. But if you follow the standards, then outcome will be best. So take home message, everyone has a role to play in medication safety. It's not only responsibility of a nurse, it's responsibility of a doctor, nurse, and the pharmacist. So know, check, and ask. So if you have any problem, know it, check for the correct administration. If you have identified anything, please ask. So once again, I'm telling, everyone plays a major responsibility in administration of medication. So medicines are a powerful tool for protecting health. As per the WHO director, he was stating one quotation, nobody should be harmed while seeking care. So as a nurse, you have to be very careful, and it's better to prepare and prevent than to repair and repent. So if you know the problem, first itself you resolve it the problem. So always after getting problem, if you do also no may not be outcome you can't see. So prepare and prevent for the errors rather than repair and repent. Thank you. Thank you,
Thank you.
Pratish.
Thank you so much, Jivita, for the crisp and simple presentation. The panel is open for the discussion. Now we request all the participants to post your questions or queries that we need to address. Meanwhile, I welcome our expert panelist for the day, Dr. Srinivas sir, to join the panel, and let's discuss about more about the medication errors and how to prevent and what will be the strategies that we can use in the healthcare profession to minimize this, not to minimize, but to prevent completely the harm due to the medications.
Yeah, good afternoon all.
Good afternoon.
Good afternoon, Jivita and Pratyusha.
Thank you.
It's always very nice to be part and parcel of an academic schedule, and that to be in touch with the nursing team. And all of us know nursing team are the main pillars of all the treatment modalities which occur in everywhere in the world. See, what usually happens once a doctor's clinical team diagnoses, puts some medications onto the paper, and as Jivita has clearly explained, there are so many ways in which errors can happen. See, all the entire team, like in a medical team, clinicians, paramedical people, nursing team, pharmacists, all try for the betterment of the patients. But Ash has clearly portrayed that there are many ways that errors can happen. Writing from the doctor's prescription, then prescription going to the pharmacist, then pharmacist understanding the prescription, then pharmacist delivering the medications, and medications coming back to the patient side, and once again sorting out the correct medications to the correct patients and correct way of administrations, IV, IM. There are so many ways. And in all this juncture, what everyone has to understand this nursing team plays a very, very important role, because they are the actual people who directly come in the treatment of the patients. So now what I would like to request and tell all the nursing team is, now this is not a time where you only play as a mechanical way of delivering. You should be equally knowledge. The scientific knowledge should be there. Why? Because now these days so many newer modalities are coming, medications are coming, research is going on. So all the nursing team should be well equipped with the newer updates. And one thing which is very, very important is for the proper delivery of medications to the patient is every sister or every nursing department should know clearly what is happening to the patients, the clinical diagnosis. They should be very, very actively involved in the patient management. Otherwise, what will happen? What is the medications which are going to the patient? Suppose sometimes some errors occur, she can easily pick up. There are so many hundreds of examples like which I can quote where errors have happened. And now from all these errors, we need to learn. Simple reason, suppose you write an insulin, normally a long-acting insulin which usually given at 10 to 30 units. Instead of the 10, if extra U is being put and it comes as another 0, it comes as 100 units. But what will happen before delivering? The sisters should have some knowledge about what is the dose of the insulin, what is the normal dosage. Otherwise, then she'll be able to easily pick up that this is not, something is wrong in these prescriptions, and she can take immediately the help of the clinicians and deliver a correct dose. In that way, even the medications like antibiotics, higher therapies like immunotherapies, every drug modalities, the nursing department should be actively involved in the clinical diagnosis. Then she should understand what is happening, whether it is sepsis component or immunological department, so that what will happen, she'll understand whether the medications are correct up to the patient or not, so that the chance of minimizing the errors will be definitely lower side. And the dosage, as she has correctly quoted, that oral dosage, IV dosage, IM dosage, correct medication in the correct way of delivery should be there for the betterment of the patients. I always request all this nursing department should be with the patients when the clinician comes to the patients, and actively involved in the management, listen what the clinicians are discussing, actively engage, and if any doubts are there regarding medications, straight away discuss with the clinician, so that what will happen as right medications for the right patients. And the prescription errors, she has clearly quoted that the capital form and a legible form, that is extremely important. So many errors have come, like a simple example I can tell that in COVID seasons, Ivabred and Ivipred, many times that Ivipred, instead of Ivipred, has been Ivabred has been gone so many times. Likewise, there are many errors are there. All this will definitely come down with the nursing team with active participation in the clinical management.
Sir, as you're rightly pointing out about what are the common barriers that are happening whenever we are trying to administer the medications. So can we let us discuss about some kinds of situations where we can minimize this medication errors, right? In case if we are trying to administer a medication during OT surgery. So the surgery is going on and suddenly an emergency situation has happened and now the nurse needs to give or the healthcare professionals needs to prepare the medication. What would be the type of communication that needs to be delivered during this situation, sir?
So normally, since we are the medical people, no, so surgical people will be better be able to understand and answer, but still I try to answer. So normally in pre-op and all issues, what will happen? Suppose they give some pre-op medications or pre-nesting medications, usually they will be able to develop some allergic manifestations. So recently our scenarios have developed, the patient has been delivered a test dose of medications. Test dose of medication has been given, immediately the patient started swelling of the whole upper limbs and entire body, the blood pressure started coming down. So such things you need to immediately understand that there is some anaphylactic reactions. In such scenario, there is nothing much, there should be direct communication with the clinicians or the entire team with it. You should be able to resist it immediately. Flush with a plenty of fluids and so that the blood pressure comes up. Injection steroids in form of hydrocortisones, avils, and still much worse, take the help of adrenaline. And all these things are very common things that all of us know in the nursing department, especially surgical departments, that whenever you administer a drug for the first time, especially before surgery, we never know that whether they are sensitive to that particular drug or allergic to, but because the patient coming to the hospital for the first time, she will never understand whether she is allergic to medication or not. So such scenarios with a proper good knowledge like resistant measures in the form of IV hydrations, hydrocortisones, or avils, or sometimes adrenaline is always there. They're always there in every theaters and everywhere in the ERs and every bedsides. So that should be there to proper resuscitation. Similar happened recently, and fortunately we could resuscitate the patients. Edema has come down, angioedema was there, it has come down, pressures were coming down, pressures improved, and slowly what happened, the amount of dose also. Sometimes the drug reactions are two types. A lot of us know that it's anaphylactic reactions, idiosyncratic or dose dependent. So if the nursing people can identify the earliest, they will try to restrict the amount of dosage being given in. They'll stop the infusions so that the chance of further aggressing that reaction will come down.
Yes.
There you can follow. There you can follow closed loop communication.
Yes, that's what I meant to say. So closed loop communication every time we talk during the emergency situation. So for example, any kind of medication has been told or given as order from the doctor. So it's a injection adrenaline needs to be loaded up for 1 mg. So immediately the nurse or the person who is loading the drug needs to say that, yes, 1 mg of adrenaline loaded and waiting for your orders, or followed by a flush. So this is how the loop has been open and the loop has been closed. This is how we need to start a closed loop communication during the emergency situations. Well, sir and Jivita, do we have anything that we can do with the audits to improve this or to prevent this medication errors?
Yes.
Yeah. You just
because see, most of the time what happens, if you do the audits, we'll come to know where is the real problem. See, unless and until if we identify the problem only, we can take the corrective actions.
So you mean to say it is root cause analysis?
Yeah, root cause analysis, and based on that we can do corrective preventive action CAPA. So by that we will be improved ourselves and the further errors will be reduced. So frequent audits, frequent training, really it will help us, or especially the nurses help them to reduce the errors as per my knowledge.
Nice. I think the audits would also improve the, we need to also have few strategies that should be developed out of this audits so that we can need to go for further trainings, or either it is improving or deteriorating in the performance of the staff. That also we need to monitor apart from having only the audits. Yes. Anything?
Yeah, well said. Now, fully agree with you all people. But now that's the training, the auditing, not at the end, is that day-to-day also it has been done. So recently, today morning, we have seen long-acting insulins like Legodac has been written thrice a day. So thrice a day, that can be an error from the clinicians or from the sisters. But what happens when we are equally involved, what becomes, even sister also should understand, or nursing department should understand, like what is this drug, what it is used for, what is the way of administration, what is the duration of actions. So same day, same time, day-to-day basis also we can clearly check errors which are happening. In the same time, what we usually do is we'll train the nursing department. So when we're putting some drugs or the new names which are there in the prescriptions, we always try to train the nursing department. Like this is so and so medications, this is given for so and so modality, and this is given once a day or twice a day. So that what happens is a continuous medical education of an entire team, right from a junior doctors, and nursing teams, a paramedical team. This is the only way by which you can minimize errors. See, there is nothing in our medical field, all of us know there is nothing like an end of learnings. So every person has to learn till the end of their life. So similarly, all that our nursing team, paramedical team, whoever is involved in the patient's care, should clearly understand what medicines are going on, what are they for. Because suppose suddenly the attender comes and asks like they are delivering these medications, the nurse should be immediately able to tell that this is so and so medications we are giving for some XYZ purpose. That elevates the quality of care, that elevates the trust of the patients, attenders in the patient's management. So for all that, we stress that the continuous medication education should be there in all departments.
Great, sir. As you said, like the healthcare team, not only the nurse or the physician, but the healthcare team members needs to be involved in decision making, even with the stakeholders like the customers, like our patients also need to be educated about what kind of medications they are taking. Sir, apart from this, in case how can we minimize these distractions and interruptions? Sometimes the wards will be busy, or continuous call bells will be there, or the nurse will be attached with a few more patients. So how can we minimize this interruptions or distractions?
So usually what happens, like as you rightly said, now some errors is all human errors can occur. Usually most of the times in the odd hours of the day or odd hours of the night, all these are more prone to occur. Even the patient cares, like in all sections, or the ET cares, and all those things that can occur. But even a minor error can lead to so much devastating complications in the patients. So they should be scheduled. They should be scheduled, and every nursing department or paramedical department who are trying to deal with the patient should clearly understand which is a priority, which medication installation is very important, or which patient care, like our ventilator patients, nursing care, tracheostomy care, they have to prioritize. And whenever they're trying to leave from that particular patient, they should clearly understand that in how much amount of the time the next person should come and take over. So some patients might be little stable there, even the lag of around 10 minutes or 15 minutes before the other person comes, still that is advisable or admittable. But sometimes what will happen, the patient is in a very critical situation which you cannot give a pause of even a few minutes. It's always better to coordinate with the other team. Once the other nursing care person comes, you clearly explain her or him that what is happening, what is going on in these patients, what has to be done, what was the medication which are going on. If any reaction you have observed, please tell that person XYZ that this is what was happening, so that the careful handing over of that person's clinical scenario to the next responsible person will definitely minimize errors.
As a part of this, policies and procedures always teach us in the organizations that we need to follow the standard protocol, like verbal orders during the emergency situations, and read back policies and recalls needs to be really insisted from each and every person among the healthcare team members. Apart from this, what is a take-home message that you wanted to give us for understanding the strategies to improve the medication safety in the hospital, sir?
See, we always feel that though our clinicians are so much busy in trying to understand the diagnosis of patients, but what all depends upon is the nursing care, which all matters, because we have seen plenty of scenarios where the diagnosis was correct, medications were correct, but still patient outcomes are not to the acceptables. All these things from the treatment part, delivery of nutrition part, nutrition medication part, all this plays a huge role. For all this to happen properly and patient outcomes becoming much better requires a good nursing care with a very good commitment, as we're all doing, and which much more enhancing the commitment, and with more medical educations, right? I still see nurses who are very eager to learn the newer modalities, newer medications, but that should go on. And every nursing department or every person who's trying to treat a patient should be well aware of the clinical diagnosis, well aware of the medication which are trying to give to the delivery of the patients. And every nursing department should know what they are delivering. See, that is a very important scenario, because plenty of the times we see that suddenly attender asks that what you are doing, you should be able to answer. That elevates the entire care. For all that to happen, if you are actively involving in the patient care, not simply administering the medications, it will definitely increase or enhance the patient care.
Thank you so much, sir. That was a wonderful discussion that we have got. Thank you so much, Jeevita.
Thank you. Thank you, sir.
And this is for today. And we are at the end of the webinar. And thank you so much. And I hope no questions were there in the queries or in the chat sections that I have gone through. And we are going to come up with the next interesting topic for the next Thursday at 3 p.m. Please stay tuned in case if you have any queries, or if you try to miss any webinar from the initial part, please go to the Yashoda Hospitals Facebook page and you can watch the webinar which will be post recorded. Thank you so much, everyone. And I would like to thank our director of Yashoda Hospitals, Dr. Pawan Gorukanti, sir, who has given us this nursing education and training webinar series platform to explore the nursing education knowledge. And also I thank Dr. Lingaya, sir, our DMS, and our AVP, Dr. Amar, sir, and our GM Nursing Education, Vimla Prasad ma'am. Last but not the least, I also appreciate the best support from our team Nursing Education and Mr. Pawan from Digital Marketing. Stay tuned to us. We'll meet next Thursday. Thank you.
Thank you. Thank you.